we've seen cases where after the whole process of IVF, it comes out negative. It's painful when you go through that process and at the end of the day, it doesn't yield the fruit you wanted. Are there success rates in IVF?
Yes, you see, there are quite the factors that mitigate the success for IVF. And of course, when you're looking for those factors, these factors are embedded in the couples you're treating.
Okay.
The one and most important factor that can be a negative impact to IVF treatment cycle worldwide is the age of the woman. And there's nothing you can do about this age. We have it in biological sciences that from the age of 35 and above, from 35 as a watershed age, there is an accelerated decline in the number of eggs and in the quality of eggs that a woman has. That means that she may be producing eggs at those age and beyond, but then they are not good enough to achieve pregnancy. So, and we see a whole lot of women from sub-Saharan Africa coming to seek help with conception via the means of assisted reproduction technology who are advanced in age. In fact, 38 and above, up to 44, and all, to a large extent, wants to use their egg. And the older a woman is, the lesser her chance of conceiving by assisted reproduction technology using her own eggs.
Wow.
You understand? From the age of 40 to 42, just about 10% chance of achieving success. And that's because of
10% of 100?
Yes, but achieving pregnancy with your own eggs. Then at 46, it's only 1% chance of achieving pregnancy with your own eggs.
Wow.
And this is because with age, the eggs depreciate in quality.
Okay.
That's increasing aneuploidy. We call that abnormality when fertilization occurs with those eggs at those advancing age. And these are factors that affect the outcome of IVF greatly. In fact, 98% of failure of IVF is because of the age of the woman. The younger age group do better. The older age group, which is actually the age you find a lot of women coming to seek help with assisted reproduction technology, you have a whole lot of failure because of the quality of eggs and because of the number of eggs. Sometimes there's even no eggs at those age. So that is the number one factor that negatively impacts the outcome of an IVF treatment cycle, age of the woman. So we have a whole lot of other factors, and I'll quickly mention them in the course of our discussion. One is obesity. The second is obesity.
Wow.
There is like a pandemic. Wow. We have COVID virus pandemic now, but one pandemic in reproductive medicine is obesity.
Wow.
Yeah, obesity at any age will affect the quality of eggs and the number of eggs that the woman has. There's a lot of studies that have been shown that show that there are abnormal cells during the division in the eggs of a woman when they are obese. We call them abnormal number of mitotic spindles. These are things that happen during cell division in the process of egg growing, development of egg. When a woman gets obese, she has a lot of abnormalities with those spindles, increasing mitotic spindles, and that is abnormal eggs. And what do you expect with abnormal eggs? The nature or body will take them out automatically. So now you have pandemic of obesity, an epidemic of obesity because of abnormal feeding or abnormal lifestyle. So that's another factor. Some other factors could be social factors, like smoking, tobacco, marijuana, or all these aesthetic drugs or social, creative, recreational drugs also reduce the chance of succeeding in IVF.
For real?
Oh, yeah. So if you have clients who indulge in some of these behaviors, it's usually good to take them out of those social behaviors or consumption of harmful substances before embarking on IVF treatment cycle. Then for those who are obese, it's good to shed weight, before embarking on IVF treatment cycle.
Quickly on that, how long does it take to take them out from such vices?
2 to 3 months of getting out of the vices.
And their time is going.
Time is going. A short time is going. especially time with the age of the woman, is counting on the negative part for her.
And to lose weight also takes time.
Yeah, it sure takes time. It sure takes time. So usually there are centers that you will not even be enrolled into an IVF treatment cycle if your weight doesn't drop to the safety margin of weight.
At all.
Exactly.
Wow.
There are centers where government pays. Government doesn't want to invest
waste money
in treating you when you're going to fail at the end of the day. So you'll be forced to stop the negative vices and shed
on your
weight
own
and all that before an IVF treatment cycle is done. You understand? So consumption of coffee, green teas, also have negative impact both on the eggs and on the sperm. And more importantly, in this part of Africa, we observe that women use a lot of cosmetics, you know, in the name of makeup. And some of these cosmetics have a lot of elements in them, the mercury element, the heavy metals, and all that, in the name of makeup, creams, and all that. And all the things you apply on your skin are absorbed into the hematological system, you know. And then we have what we call endocrine destructor factors coming from those things that you apply on the skin. They don't only affect the eggs or the sperms, they affect all the organs in the body. So these cosmetics affect the quality of eggs, the outcome of IVF treatment cycle. So it's good to have a detoxification period and cessation of all these elements or social behaviors before embarking on IVF treatment cycle. Alcoholism, especially as you see with men or with women, can affect sperms. And if you have poor sperms, you have also likelihood of having a negative outcome with IVF treatment cycle. So you have quite a lot of things that could affect this IVF treatment cycle. And when you identify any in any client, it's best to ask them to stay off those vices or those behavior or social recreational medications before embarking on IVF treatment cycle.
And the sad thing is habits are easily learned.
Oh, yeah.
But they are not easily discarded.
Oh, sure.
And so there should be more information, more education on things we do to ourselves, things we take, things for now. I take coffee, and I'm hearing you say coffee, and I feel,
Yeah, I know coffee has some beneficial effects. It's like a stimulant. It keeps you active. It helps in weight loss, shedding of weight. But coffee has its own negative aspects too. You know, when reproduction or conception becomes an issue, there is no amount of coffee that is considered safe. There's also no amount of tobacco or alcohol that is considered safe.
So there's nothing like moderation at this point in time.
Moderation is stopping completely. You could go back to your coffee when you're done with having
everything, all your babies, and
you're done with the pregnancy issues, you know. But then, for the sake of reproduction, it's good to stay off coffee, stay off tobacco, stay off the marijuana, stay off alcohol, and all that. More so when pregnancy becomes difficult to achieve. But then, that doesn't mean that those who consume coffee don't get pregnant.
I get it. It just increases the chances of you not getting pregnant.
In IVF treatment cycle.
The essence of information is to help you make decisions. And so if you're hearing this and you're not taking active steps, then you're not doing it well.